Hi everyone, and welcome to our video on basic epidemiologic terms and concepts, measures of association, odds ratio, and attributable risk. The learning outcomes of this presentation are to 1. Understand two of the more meaningful measures of association, an odds ratio and attributable risk. 2. Understand how each measure of association is calculated generally, and how each seeks to establish strength of association between varying levels of cause and effect. And 3. Understand how each type of measure effectively contributes to the diverse human and clinical science fields from health promotion to surveillance in epidemiology. To begin, an odds ratio, or OR, is a measure of association between a behavior and an outcome. Most frequently, ORs seek to quantify risk between a behavior and risk for a specific disease or health outcome. Common examples include associations between smoking and lung disease, and sexual behaviors and risk for contracting a sexually transmitted infection. In contrast, attributable risk, or AR, quantifies the difference between incidence rates of new cases for a specific disease, between two groups of people. People being exposed to a given risk factor such as cigarette smoke to those not exposed. Attributable risk is sometimes referred to as the risk difference. It refers to the difference in incidence rates between people exposed to some risk factor versus people who are not exposed to the risk factor. Examples commonly cited are cancer and smoking cigarettes, and cardiovascular disease in smokers versus non-smokers. One of the main caveats in gaining a more thorough understanding of the difference between ORs and ARs is to remember odds ratios most commonly seek to quantify the strength of association between an individual behavior and that behavior's connectivity with a specific morbidity or sickness. In contrast, attributable risk looks at and quantifies risk of exposure among groups of people and a condition. Those exposed to a condition compared to those not exposed to a condition. To calculate an odds ratio, we must examine the associations between behavioral exposure as they compare to the result of having a given disease or not. In essence, we are examining the odds between a case, performed a given behavior and contracting a disease, as it compares to those not performing a given behavior and the presence or absence of having that disease or condition. For an illustration, refer to the figure in the upper right corner of this slide. We then look at the difference between these two groups mathematically by simple division. The quotient of this division is a number along a continuum of positive to negative. A positive number greater than 1.0 indicates risk in order of magnitude between a behavior and likelihood of contracting a disease, while a number less than minus 1.0 indicates that that behavior is associated with decreased risk for disease. This slide highlights the numeric associations previously discussed in the previous slide between a given behavior and risk for a specific condition. For example, if we have an OR of 2.3, then we interpret that to mean that engaging in that behavior will result in 2.3 times more risk, or be more likely of contracting that disease or condition. In contrast, an OR of minus 2.3 can be interpreted to mean that if we engage in that specific behavior, we are 2.3 times less likely of contracting that disease or condition. Basically, numbers greater than 1.0 indicate harmfulness, while numbers less than 1.0 indicate protectiveness. Finally, numbers between 1.0 and minus 1.0, such as 0.55, indicate that a given behavior is not statistically associated with any type of risk for a given disease or condition. In contrast to odds ratios, the mathematics of attributable risk involves subtracting the risk of a non-exposed group of people from the risk of an exposed group of people. To perform this mathematical operation, we have to add the rows of both positive and negative exposure as seen in the graphic on the lower right portion of this slide. After we get these row totals, we then add those values to individual cases of those engaging in a given behavior, such as smoking, with those not engaging in the behavior. Finally, we divide positive risk cases from a row total and subtract the negative cases over that row's total. The mathematics of this operation yields a percentage when multiplied by 100, and we then get a percentage of risk association. For example, smoking is associated with a 26% increase for developing bladder cancer. This slide highlights general comparisons between odds ratios and attributable risk. Both measures quantify strength of associations between behavioral risks and the likelihood of developing or resulting in a specific disease or condition. Both of these measures are quantified calculations, meaning that they are represented by numbers each expressing that association. For an odds ratio, that number expresses times more or less likely in getting a disease or condition based on a given behavior, while attributable risk yields a percentage of risk between condition and exposure. Both of these measures yield invaluable trends and connections between behavior or exposure to a given disease. Public health professionals can analyze these trends and allow them to guide public health policy, as well as health educational and health promotional programming. Examples of which can include such things as safety, restraint belt usage and risk, or severe auto accidents up to and including death. A more contemporary example of measures of association like odds ratios and attributable risk includes mask and social distancing guidelines that have become synonymous with life in the COVID-19 era. Such recommendations were formed from looking at measures of risk between wearing or not wearing a mask and contracting COVID-19, as well as analyzing distances or airflow between proximal bodies and risk for contracting COVID-19. Thank you for watching and have a great day.